Well, good morning, and thank you for joining us for our fifth virtual town hall event for faculty and staff. As we begin week 3 of the semester, we wanted to take the opportunity to update you on our COVID-19 response and new mitigation efforts. We have an important program with a number of speakers, and we may have time for questions at the end. So please go ahead and begin typing your questions into the Q&A box. If you aren't able to get your question answered today, please submit it to covid19@iastate.edu, and we'll work to get you an answer in a timely fashion. I want to begin by thanking our faculty, staff, and students who have embraced our mitigation strategies and our Cyclones Cares campaign here on campus. I am pleased to see so many people doing the right thing in classes, in university facilities, and spaces across campus. When we look at the faculty and staff testing numbers, we see that our mitigation strategies are working. The majority of exposure is not occurring in classrooms or laboratories. Unfortunately, we know that some of our students are not following these strategies off campus, which is where we believe most of the exposure is occurring. We are now seeing the impact of the large parties and gatherings that occurred the weekend before campus. This has led to a notable increase in the number of tests performed of symptomatic individuals and those who have been exposed to a positive case. And it's resulted in an increase in positive cases. Fortunately, though, we are in a unique situation with the expertise of the Teelan Student Health Center and the Veterinary Diagnostic Laboratory to be able to do our own testing on campus following CDC guidelines. We have made the choice to not solely rely on self-reporting. This allows us to quickly identify and isolate positive cases to mitigate potential spread. Today, we're going to be talking about testing, contact tracing, and our mitigation efforts. So let's begin by reviewing the test results after 2 weeks of classes here at Iowa State. So if I could have that first slide up, then you can see that our cumulative testing since August 1 shows a total of 3,598 students, faculty, and staff have been tested on campus through Teelan Student Health Center, 665 positive cases for a 18.5% positivity rate. When we break it down by the first week versus the second week of the semester, you see these results. The first week, 957 tests with a 13.6% positivity rate. The second week of the semester, 1,749 tests with a 28.8% positivity rate. It's notable that 0 faculty had a positive rate of those tested and only 1 staff in the second week of testing. While this increase in cases is not expected due to the targeted approach that we're taking to testing, the individuals being tested are symptomatic or have been potentially exposed to someone with COVID-19, so they are much more likely to test positive. Now, it's important to note that these figures also include student athletes who may not be symptomatic or been exposed, but are required to be tested by the NCAA. These figures do not include the move-in testing done during the residence hall move-in. The risk of exposure off campus seems to be the primary driver of COVID-19 cases. For this reason, we enacted a new policy for large student social gatherings. We are very thankful for Governor Reynolds' decision to close bars in Story County and feel this is critically important. Also, Ames City Council's consideration of a face covering mandate seems a necessary response for the health of the community. In response to the testing results, We are going to increase our testing and our contact tracing resources on campus. Teelan Student Health Center will be opening a second on-campus testing site at Johnny's in Hilton Coliseum to serve more people quickly. Also, we are more than doubling the number of contact tracers and case managers to support our mitigation efforts to quickly identify and isolate positive cases. These actions should flatten the curve when combined with the continued practice of cyclone care, health, and safety behaviors. We continue to closely monitor the situation. Our decisions remain rooted in public health and science-based guidance. We will continue to evaluate and refine our strategies, and we will change course if necessary. Hopefully, these new strategies and increased student vigilance through this through these new strategies and increased student vigilance, we will be able to continue to proceed cautiously with the fall semester. Now I'd like to introduce Dr. Alex Ramirez to offer some additional explanation and context for our test results, testing strategy, and mitigation efforts. Dr. Ramirez is a professor of veterinary diagnostic and preventive medicine and an expert on infectious disease, and he is serving as a faculty advisor to our public health team. Dr. Ramirez, thanks for being here this morning.
Thank you, President Winterstein. It's great to be here to talk to my colleagues and all those who work here at Iowa State, so we can kind of maybe give you a little bit of a background on what's going on. So first, I think it's important to understand our testing protocols. So the way these were developed is a team was formed before the semester started with multiple people to provide information and guidance on what is the best plan to help Iowa State mitigate the transmission within Iowa State, which is what we have control over with our students. Okay? It is important to also remember that the objectives of each plan dictate what that testing protocol should be. The CDC does not recommend whole campus testing, and this is for various reasons. The CDC was very clear that the number one goal is to implement mitigation practices, which we will continue to emphasize throughout this presentation of the physical distancing, the mask covering, all those things. That's the primary goal, because our assumption is there's going to be positive people in the population. At times, there is temptation to do whole testing of everyone. Although this sounds good, the reality is diseases are very dynamic, and that testing of a single time only provide a snapshot right that instant and do not account for other things that can occur shortly thereafter. Also, we must recognize we're not a closed herd or population. That is, even though we all are a family here at Iowa State University, many of us have spouses or children that are not part of Iowa State University and would not be tested through these protocols. Many of us have visitors from outside. Many of us travel to Des Moines and local areas. So the whole herd testing is beneficial if we test everyone and then close the doors and don't let anybody else in, kind of like the NBA has done with their bubble. Create a bubble, test everyone, and don't allow anyone else to enter or leave. Unfortunately, we cannot do that. So it's also important that as we were making these decisions on what to test, we were looking at the science and the information we had, and also recognize that were some constraints on resources, primarily the limitation of some of the supplies and reagents to do the testing. So we had to focus on what is the most beneficial testing that we are likely to were able to do, and yet provide us the guidance and information we needed. So initially, our testing at move-in, and we'll talk a little bit more about this, was targeted at identifying what the prevalence is on that population that was moving into the dorms. It's a population we could determine when they could move in, and we could execute and try to establish what the prevalence or how many of them would be positive. After that move-in time, we changed our approach. And our approach was then focused on identifying positives so that we can go ahead and quarantine or isolate as needed. In the media, in the news, you hear a lot of different protocols and tests that are available. Sounds easy, but the reality is a lot more complex than that because this is a public health situation. A lot of those tests require some type of approval, and not at a national level, but at a local level. And also, some of the things that they talk about sound easy in a lab setting, but once you try to implement the logistics, become very complicated. So in our decision making, we included all this information and we continue to evolve our testing based as the information is available and those resources are available to us. Next slide, please. So really, when we look at data and we hear about positivity rates, there's really, in my opinion, four different questions that I would have. First, what does the testing numbers really mean? Second, now that I understand that, what are my risks? And then third, what will happen if I really get exposed? And then fourth, how can I prevent or mitigate exposure? So I will go through these to put them in the context that we're using this information to help protect Iowa State and our community around us. Next slide, please. So first, what do the numbers really mean? Again, it's dependent on the goal of testing. When we look at that goal of testing, we need to interpret that in that context. Okay, that context is our goal currently for the past 2 weeks was to find positive. Our goal was not to try to reach a certain number of negativity. Our goal was to try to find those positives because we all recognize that when the students move in, there was going to be mixing of students and the positivity rate would go up. So we want to be able to identify those positives and isolate them in order to help protect the rest of the population. So we need to understand the context. Okay. We need to understand what's the denominator. When we say we had more positives or a rate, we really understand what the numerator and the denominator. And again, we're talking about a student population. So as you hear numbers, you need to reference it based on how many students are here at Iowa State. We also need to understand how that compares to maybe some of the other testing that may occur at other locations. So again, first 2 weeks, we were focused on prevalence, roughly what percentage of students might be positive, so it would give us a guidance on what we might expect in the future. Then we moved to a selected or targeted testing. So you can imagine when we have the entire population of students moving in, we're going to have a lot of negatives as expected. So the percent positives is going to be low, and it was quite low. We were pretty happy that there wasn't a lot of positive individuals moving into our population. But our second testing for the past 2 weeks is to just focus on the positives. So our denominator is now mostly those who we expect to be positive, which means our numerator, that top part, the number of positives compared to a denominator, is relatively going to be high because that's what we're trying to do. We're focused only on those who are positive. We're not trying to bring in all these other negative individuals because we're focusing on resources and trying to find those positives. So we really can't compare our numbers of positivity to any state or national numbers or even to other schools because we don't understand what that population that they're targeting and what their objectives in their particular situations were. We're focused on identifying what our numbers mean for us and how we utilize those numbers to help mitigate the spread of COVID-19 in our population. So if we're looking at our goal to find positives, we're happy that we're finding those positives. That means our contact tracing and our approach is working. We are finding those positives. Okay. We also are trying to remove any of those that we can find so that we can also try to mitigate. Now, fortunately, as President Winterstein mentioned, our faculty and our employees, we have very few positives. Again, that risk of exposure within our university community, where we've implemented a lot of mitigation processes, it still continues to be low. Next slide, please. So now what are my risks? Well, I think the CDC recognized those individuals who are at higher risk. And you can go to the CDC and look at those definitions. Although some of us might feel we're at high risk because we're concerned about disease, the CDC is very clear on what type of individuals are truly at high risk or live with high risk individuals. And the university has been very proactive to working with those individuals to create those alternative work arrangements if you fit into those categories, because those are the people we need to protect at the highest cost of exposure, right? So then the next thing we need to look at is what is the risk of exposure? So the risk of exposure is primarily, or the definition of exposure that the CDC utilizes is being in close contact, that means within 6 feet of somebody who's confirmed positive. And that close contact needs to occur for at least 15 minutes, continuous minutes. This is very important. So although somebody in your group or a student may have tested positive, because you talked to them for maybe 30 seconds or walked by them for a short time, that is not considered an exposure. To have that exposure, you really have to be at least 15 minutes in continuous contact with that individual closer than 6 feet. When we look at one of the things that we try to evaluate diseases, we try to consider transmission rate. Okay. And let me give you an example. When we have influenza, and we get influenza every year, we know people get exposed to influenza. We also know that often we're in groups where an individual has flu-like symptoms, but yet we never get sick or come down with flu-like symptoms. So again, just because somebody has influenza doesn't mean that automatically we get influenza. And it's the same for COVID. Just because somebody or a student or a colleague or an employee has COVID is not by definition an automatic that you will get the disease. Again, you need that exposure that I just mentioned. So how transmissible is this disease? One of the rates of transmission that is utilized in epidemiology is what we call the reproductive rate. Okay. Originally, it was considered that R naught, or reproductive rate, was thought to be somewhere between 1.4 to 7, whereas current data suggests that it's actually probably closer to 2 to 3, somewhere between 2 to 3. What does that mean? That means that for each positive individual, on average, one individual spreads that to maybe 2 or 3 other individuals. As you can imagine, most people on campus or in town get exposed to a lot more people than just 2 or 3. So again, the majority of the population does not have that transmission occurring, but transmission does occur. Want to compare that to seasonal influenza, the seasonal influenza that we're all familiar, the transmission rate, or the R naught, is estimated somewhere between maybe 1 to maybe 2.1. So very similar, slightly lower, but very similar to COVID. If you look at something that's highly transmissible, especially something that spreads via aerosol, you look at something like measles. Measles gets in the air, stays in the air, and the transmissibility rate of that is closer to 12 to 18. So dramatically much higher risk of exposure with measles than maybe something like COVID. So again, if we look at the goal of the mitigation practices, they are designed assuming we have positive students or individuals. Again, I have to highlight this. So the mitigation practices are designed specifically with the assumption that there's positive individuals. If there was no positive individuals, we wouldn't have to wear masks and face coverings. We would not have to social distance, right? So these are implemented as barriers because the assumption is we're going to be around people who are positive, and those barriers help protect us. Those include the face covering, which the university has been proactive in making that a requirement. By making that a requirement, they're protecting the rest of us. Physical distancing. Those are important because with that physical distancing, we can also make sure we protect others. So let's move on to the next slide, please. So again, Assuming there are some positives in the populations, we created those alternative work arrangements for those who are at high risk. And then we started implementing a lot of our mitigation practices. The face coverings that mentioned, also reducing classroom student capacity by 50%. We also moved all large lectures where probably that somebody's positive in a larger population might occur into all online. We changed class hours to allow more time between classes so that we minimize that exposure, especially in the transition time. We've increased sanitation, including the daily cleaning of classrooms. We have extra hand sanitizing stations throughout campus, and we promote that physical distancing, which is very important. Now, I will also mention that that physical distancing in Europe is actually half the distance we utilize here in the US. So a lot of Europeans utilize a 1 meter or 3 feet physical distance as their barrier. So we're using twice as much physical distancing as our standard to create extra protection in the US. And then we also have the daily health monitoring, as well as our increased testing, which was targeted or decision making by our university so that we can more quickly identify those positives and keep on removing them from the population to mitigate exposure to the extent that we can. Next slide, please. So, what happens if I get exposed? So one of the parameters from public health that we also focus on is what is the severity of disease for the general population. And if you look at the hospitalization numbers, ICUs, and let's not say deaths, but the most severe outcome, those numbers are extremely low, especially hospitalization and ICU numbers are quite low in our area, suggesting that although people are getting sick, it is not taking them to a very severe disease. And we hope that that continues. When we look at our students, that's one of our challenges. Our students are a population that are all known to be on a high risk behavior. They're young and they're in that age where they don't see some of those vulnerabilities. They recognize they have several other students who are positives who maybe don't show clinical signs, maybe don't have a little bit of fever but nothing too severe. So it's not detracting them from trying to do some of those behaviors. So some of those mitigation things that are implemented are helping protect those students who don't see this maybe as risky as many others. For the rest of us, again, a lot of things are similar other than maybe for some of us that have that higher risk category, we have that ability to look for those alternative work environments. Next slide, please. So again, if we look at those numbers that President Winterstein mentioned, we only had one faculty, we didn't have any faculty members tested last week positive through our ISU testing system. So again, we're helping to protect our employees and our faculty. Same our numbers, I can't remember our numbers directly for our staff, but also those numbers are very low. So we're protecting our ISU community and our campus. So how can you prevent, how can you mitigate some of this? And I think this is probably one of the most important parts that all of us have really the ability to control our exposure. Okay. It is up to us to practice the things that can help protect us. We know that physical distancing is important. Okay. So let's keep that 6 feet barrier. That 6 feet, if you look in the classrooms, we're keeping our students 8 feet. Okay. And yes, a student may come up and ask me a question, but that interaction is usually less than 15 minutes. And I have the control where if I'm concerned about that exposure, to tell the student, stop. Can you create a little bit of more distance and we can still talk and keep that 6 feet distance. The university, again, has made that face covering a requirement. So we don't have to worry about putting that pressure on that student to have that face covering when they come up close to us in class. We wear that face covering to protect our students and our employees around us. So we have the ability to control our exposure. Now, some might be concerned about outside students not wearing the face covering as often, because I think inside the face coverings are used quite extensively. Outside, sometimes we have a little compliance issue. The reality is outdoor exposure is significantly less than indoors, and that outdoors, as we're walking by someone, the data continues to tell us that is not a risk for exposure. And what we can do when we're outside, if we're seeing individuals not in compliance, we can select the path that we take walking by them to even mitigate more of those risks. So we have full control. Our classroom lectures, again, have been designed to create that separation. Okay. Again, we have control of where we interact with our students. If we have to be closed, we can limit those interactions to less than 15 minutes so that we don't have that exposure. We do recognize we have labs and studios where we can't always maintain that physical distance. But again, we have other practices, decreasing our student numbers in the labs, creating more separation. And even as an instructor, if I have to work with the students in the lab, I can get close to them, interact for the minute or two that I need to be close, all of us wearing our face coverings, and then I can take some steps back to create that physical distance to continue the discussion without having to be right in close contact with them. Same with the lab partners. When they need to, they can be together, and when they don't need to, they need to take some steps apart. Again, remember, the Europeans used a 3 feet separation. So any type of separation doesn't exactly have to be 6. Even 3 feet can provide you that protection. We're strongly recommending 8 feet, 6 feet, to give you that extra protection, and the 8 feet in the lecture because of the talking that is going on. And then again, let's just remember that outdoors, that exposure is significantly less than indoors, and therefore our focus needs to continue to be in those classrooms. So based again, when we look at our mitigation practices in the classroom and we look at an increase in positivity rate, trying to create barriers in the classroom at this time and saying, don't come to classroom, if that's not contributing to the spread, that's not going to have impact in slowing down the spread. We're focused in the classroom, we're focused in protecting the employees, the faculty, and the students. So remember, you have great control over exposure, and you can implement practices that can help you mitigate that exposure. So with that, I'll give it back to you, President Winterstein.
Dr. Ramirez, thank you so much for that great presentation. Really appreciate it. And I'd like to now go to Dr. Roger Main and ask Dr. Main a question that's on many individuals' minds, and that is, why aren't we doing the saliva testing at Iowa State? Roger, could you address that question?
Sure. So the saliva testing is the use of saliva as an alternative sample type. Just to be clear, is like those are kind of two different things. Currently in Iowa, and through our collaboration with the hygienic laboratory, saliva has not been approved as a sample type for diagnostic purposes. Okay, and such approvals occur on a lab by lab basis. At Iowa State, what we're using is a nasal mid-turbinate swab as our sample type of choice. So for all the testing that's going on for the students and faculty through TLIN today, and for the last number of weeks has been this nasal mid-turbinate swab, okay, which is a significantly less invasive procedure than the nasal pharyngeal swab, which has been kind of as this thing came out, as kind of the gold standard sample type for COVID-19 PCR diagnostics. And all indications are that this NP swab this nasal mid-turbinate swab is working very well, very effective, very sensitive, and so on and so forth. So, and it's a very rapid procedure as far as for collection, and it's much less invasive on the individual. So it's easier to collect, it's fast, and so that's kind of why That's what we've been approved to do is kind of these gold standard, both nasopharyngeal and nasal mid-turbinate swabs.
Right. Dr. Main, thanks for explaining that essentially we don't have approval to do the saliva test in Iowa, and we feel very confident about the testing protocols we're using.
Correct.
Right. Thank you, Dr. Main. Now I'd like to turn it over to Dr. Kristen Obink, our COVID-19 Public Health Coordinator, to Erin Baldwin, Assistant Vice President and Director of TLIN Student Health, and Dr. Frank Peters, Chair of the University COVID-19 Response Team, to share more about our contact tracing process, faculty notification process, and our university response teams. So I'll turn it over to this group.
Thank you, President Winterstein. Good morning, everyone, and thank you for joining us today. I'm going to briefly review some of our existing processes with all of you, and then turn it over to Erin Baldwin to speak some more about some other things we're going to be implementing. So just to review our case investigation and contact tracing processes that we have in place, the Iowa State Public Health Team is notified of positive cases in two different ways. Of course, if someone is tested through our TLIN Student Health Center, we're the provider on those, and so we have that positive test result and the negative results. And people who are tested at external sites, so such as Test Iowa or other clinics here in town or outside of Ames, we do request that anyone who uses those testing sources and tests positive, please self-report those through our self-reporting questionnaire. It's available on the TLIN Student Health Center website. We're also working to put that up in more places so that it's more visible for individuals to find. A case investigator is assigned to any positive case, either tested here or that is self-reported from an external source. That case investigator conducts a very thorough interview with that positive individual. During that interview, we provide guidance on isolation and resources that are available to them. And then a list is compiled through that interview of ISU-associated close contacts. And again, that CDC definition for who is defined as a close contact of a positive case is anyone who is within less than 6 feet for 15 consecutive minutes or more to a positive case. Those individuals would be considered potentially exposed to COVID-19. Our contact tracing team contacts individuals who are determined to be those close contacts of a positive case, conducts an interview with them as well. During that interview, we provide guidance on quarantine and resources, and also connect that person with a daily symptom tracker to help map any symptoms that might come up during their quarantine period. Next slide. And just a review of our isolation and quarantine procedures. Patients who test positive for COVID-19 by CDC guidelines must isolate for 10 days. Patients who are identified as a close contact of a positive case must quarantine for 14 days. For students who are living within our Department of Residence here on campus, we have isolation housing available in Linden Hall, or students may also choose to isolate at home. We have quarantine housing for those who are determined to be close contacts of a positive case. That's available in Oak Elm Hall, or the students may choose to quarantine at home. Our Department of Residence assists those students in moving to those isolation or quarantine spaces here on campus, as well as back to their regularly assigned rooms when those periods are over. And then students are also provided resources by the TLIN Student Health Center and the Department of Residence. Those staying on campus here in our Linden or Oak Elm halls receive check-ins from the TLIN Student Health Center, as well as student counseling to address any mental health concerns, which we all know is of utmost concern during these challenging times as well. So I'll turn it over to Erin Baldwin to give you some more information on some other items.
Thank you, Kristen. And if we can move to the next slide, please. So one of the areas that we wanted to lift up this morning is mental health support that's available to our students, faculty, and staff. We really want to emphasize the importance of being caring and compassionate to members of our Iowa State community who test positive or are identified as a contact of a positive case. We've spoken from the beginning about the importance of not stigmatizing others, and it's more important than ever that we are supportive of others during this time period. There's certainly many feelings that come with testing positive, being a contact, or with supporting others, and any of those feelings are normal, and we want folks to know the mental health support that are available to them. So on the slide here, you can see we have lots of student support available through our student health and wellness unit, through student counseling services, our Teelan Student Health Center, student wellness and recreation services. And this unit really tries to provide all levels of support for students, whether it is in-person counseling, group counseling, activities, self-help, really any type of activity that meets the students' needs and where they're at that point in time. For our faculty and staff, we have a great employee assistance program, and I encourage everyone to check out the resources available to that. I also wanted to lift up a new program that was brought online this fall through partnership with student government, and then that is called Therapy Assistance Online, or TAO Self-Help. And this is a program that's available for students, faculty, and staff. Anyone can go online, sign up, get resources, and there's many different activities that we can all go in and check out that can support our mental health. So I'd encourage you all to check that out. Moving on to the next slide. So our goal has been to continuously evolve our public health plan, broadening our work to address whatever current situation is happening on campus. So we're doing a continuous review of our data to build upon and modify our processes. As President Winterstein mentioned earlier in the presentation, we have a new long-term testing site that will be opening soon, and that will be at Johnny's in Hilton. We will move a majority of our COVID testing there, and I've seen a lot of questions in the Q&A coming in about other options for expanded testing, and this is going to give us increased capacity to expand our testing strategy. So we're excited about what is coming forward in this area. We also have expanding capacity of our case investigation and our contact tracing teams. So as of Friday, we had over 90 case investigators that had been trained and over 120 contact tracers. As you all know, it's very important that we are able to do timely notification, and we want to continue to support our university goal of identifying and isolating positive cases and then quarantining potentially exposed individuals to mitigate risk. We're also constantly working with our colleagues in information technology, appreciate their support to see how we can use technology to make our public health work as efficient and effective as possible. We've also been planning for our COVID vaccine distribution as we continue to get more information from IDPH and the CDC, and we'll look forward to sharing more information as soon as that's available about vaccine distribution. And now I want to turn it over to my colleague, Frank Peters.
Thank you, Erin. Despite all the work that the fall planning team put together since April, we knew there was going to be issues that developed. And so President Winterstein formed the University Response Team, so we were able to respond to that. So this is a resource for all faculty, staff, as well as grad assistants for any problems and suggestions. Multiple ways to access this team of people. The most common one is the college response team. Every college has a response team headed by an associate dean. They are really out front and solving lots of problems. And then we meet daily to discuss those and seeing how we can handle those. In addition, there's the other units such as IT and FP&M, which always have had a response team. And so if you know you have a specific IT problem, then go out to them. If that's not working for you, then feel free to contact the response team to see if we can get a better solution. So as I mentioned, we have representation across campus from all the academic areas, as well as several other support units as well. And so we are meeting daily. Most of the questions that are brought to this could be answered or are answered within the group because we have all the experts there. Some requiring follow-up, and then some require follow-up with the senior leadership group as well as the Emergency Operations Center that I'm meeting with daily. This group, our university response team, is largely a sounding board for the associate deans to bring problems here, discuss those, what is the best practices, and so that we have a consistent approach across campus. And the other thing we can do is recognizing trends and identifying problems that we need a bigger solution on. So speaking of that, going to the next slide, I've prepared some of the frequently asked questions that we had in the last 2 weeks and some updates regarding this. So the faculty notifications. There has been some changes to this process as we work through this, and we think we have a much better process. And so going forward, there's going to be 2 notifications that occur. One is going to be an initial notification to a faculty member, copy to their department chair, stating that there was a positive case in your classroom, and asking that, and the purpose of this largely is for the faculty member to upload any additional information that they have that can assist the contact tracers to the sidebox. I'll talk about more of that later. No additional needs are required by that faculty member, and I'll refer back to Dr. Ramirez's comments that we can go on the reasonable assumption that there is probably somebody positive in the case. And that's why we're doing in the classroom. So that's why we're doing all the mitigation strategies. So nothing additional is needed if there are positive cases identified other than provide us the information through the sidebox. The second notification is the Dean of Students, which is coming from Assistant Dean Kip Van Dyke. This is the same notification that we've been using for the last several years. If a student was not able to come to class for several days because of an illness or other family emergency. So we're utilizing that system. And so that email will have the specific student and the section number and when they are expected to return to the classroom. Please note that this is going to all sections, whether it's in person or online. And so you're notified of that with a CC to the student's advisor. Whether the student is isolating because they tested positive or quarantining because they're a close contact will not be distinguished in this letter. You're just going to get the student's name and when they're expected to return. We are working to also get this copied to the department chair as well, the department chair of the instructor. And so that is a work in process. And so in the meantime, we just ask faculty if they could forward to the department chairs. The department chairs want to know we are working on them also be included in that. Please note there's not an official notification coming from the Dean of Students or anyone else because the student needs to miss because they're not feeling well. In a previous communication from Provost Wickard, these are an excused absence because we don't want these students showing up in class, but it would be a huge burden for us to verify this and getting a notification out. So we need a asking the faculty to be flexible here because due to the Cyclones Care, one of the initiatives is if you're not feeling well, stay home, and we don't want these students in the classroom. So we need asking some flexibility here. Well, you will get notified if the student has to officially quarantine isolate. A few words on the seating charts. A sidebox was created for every instructor of record, the primary instructor of record as identified by the registrar. If you have your seating charts and they're going to be the same all semester, I encourage you to put those in there now. If you're doing team-based learning or it's a studio or it's a lab and those seating charts aren't the same every week, you can stand by until you get the initial notification that there was a positive case, then upload that information. Ask you, the contact tracing team has lots of details to go through. If you can make that information so they can look at that and interpret it clearly without coming back and asking you for additional information, that'd be greatly appreciated. And next slide for a few more updates. One of the issues that was reported to us was that students felt isolated while they were in isolation and quarantine, especially for the on-campus students. As Aaron Baldwin pointed out, the Department of Residence has a contact with them, as well as Counseling Services is making contact with them. But one call to action, I think another step that we can do is the academic advisors who are getting notified from the Dean of Students, if they could do another reach out to these students just so they feel connected and seeing if there's anything else that they need. Other question was space for students to participate on online courses, especially if they're on campus between classes. We will have a schedule by Wednesday of spaces that students can go to, and so classrooms that aren't scheduled or maybe some other spaces. So that will be available and communicated on Wednesday. The other item is that there's some tents on campus, and there's a few more tents coming to campus, utilizing picnic tables from across campus. They're going to be underneath those tents and additional Wi-Fi. And the picture here on the right is if you go to Iowa State and go to maps, there's a new option now down the bottom of outdoor Wi-Fi. And so you can identify those areas that have a very good Wi-Fi signal. That is end of my comments.
Great. Well, I want to thank Dr. Obink, Assistant Vice President Aaron Baldwin, and Dr. Peters for that set of presentations. And now I'd like to invite Provost Wickert to provide some additional information for our faculty and students. John?
Thank you, President Winterstein. Well, as we know, we have 4 different delivery modes for courses this semester: in-person instruction, hybrid, online, or what we call arranged sections, which really represent independent study and research. And earlier this summer, in some of the communications that I distributed from my office, I informed everyone that no instructor will be forced to teach in person. And instructors have flexibility to modify the delivery mode for their courses, and they can modify that delivery mode either temporarily or for the remainder of the semester. And I'd like to just say a few words about the process for doing that, which is really the faculty member starting with their academic department chair, consulting with them and having that conversation about changing the course's modality. And then, as we have really done throughout the summer for fall planning, make sure that the associate dean for academic affairs within that college is involved in that conversation. And the associate dean does need to approve those changes, working with the faculty member and the department chair. I would say that the same also applies to teaching assistants and graduate student instructors. I think in that case, those TAs or grad student instructors should really be speaking to the course's coordinator or the instructor of record for that course, as well as their director of graduate education in their department or program. And we take this approach because we know that faculty know their students and their courses and the learning objectives in the curriculum the very best. And I trust each and every faculty member to make decisions about their courses. Now, as we've seen in the chat, there's a number of questions on this point. And when these decisions are made, it really involves a balance of multiple factors. One is the faculty member's own personal assessment of risk. A second factor could be the number of students in the class who are absent or who are known to be in isolation or quarantine, as well as the course's content and pedagogy, whether it's a lecture course or a laboratory course. I would also say it depends on the level of the class as well. And what we all know is the hallmark of ISU, and that is that engagement between students and faculty and their classrooms, which really provides for an enriched learning experience. It's also important to know that these decisions have implications beyond just the course. The department, the academic program may be an accredited program, and we all need to take into account making sure that we meet those accreditation requirements and working with those agencies as appropriate. And we also don't want any of these decisions to adversely affect the students' path to graduation. We want them to stay on track for completing their degrees. So I recommend that departments collectively have those discussions with faculty so that we can also take a program level perspective to this very important issue. And after today's town hall meeting, I will be sending out a communication to faculty later on, reinforcing these points, which we had communicated in some of the memos over the summer, but there was a lot of communication over the summer and it might have been missed there. I'd also like to just quickly comment on what we know is that some students also may want to move one or more of their courses online as well at this time. And I believe there was a question in the chat on this issue as well. In those cases, I think we all should be working, faculty advisors, student services staff, student affairs staff should be working with the student to explore options. And there's several options, maybe no silver bullet, but several options we can pursue with students. One is just to see with the faculty member, is it possible for that student to participate remotely? Since it's possible or even likely that a lot of the course's material is online already, maybe moving to an online section of the class or changing their schedule. Now, changing the schedule could be difficult now that we're in week 3, but that should be an option that we look at and even consider the spring as well. Is it possible to flip a course that may have been taken in the spring with one here in the fall to accommodate the student? And of course, we also know, as we've communicated previously, that any students who have an underlying health concern that meets the CDC criteria should visit with the Dean of Students office and their website so that they can make a request for a health accommodation. So, thank you, President Winterstein.
Provost Wicker, thank you very much. And we have a number of questions, and I said earlier we were going to run out of time before we could get to every question. But let's go ahead and start looking at the Q&A. But first, a quick thank you to all the presenters. They did a great job. Dr. Ramirez, this question is for you. How can we stay with in-person classes with this high positivity rate?
Yes, so good question, right? That's the first question we come up with. So the important thing to recognize are two things. Where is transmission occurring? And second of all, where are these positive students? So we can tell you those students who tested positive, they've already been removed from the classroom. So that minimizes that risk. The second is, what is the transmission, or where is that transmission occurring? So again, in the classroom, in our labs, they are designed to mitigate transmission. The assumption is we already have some positive students in that classroom. So the things we're doing are mitigating that transmission in the classroom. Moving things online at this point are not going to prevent that transmission, because from the data we're seeing that transmission is occurring outside of Iowa State campus. Okay, when it's off campus, our canceling classes is not going to help that mitigation. And again, our testing is designed so those students who maybe don't follow the procedures off campus, as soon as we can detect them, we're removing them from the campus interaction to mitigate the risk for the rest of the people.
Great. And Dr. Ramirez, I want to stay with you for a couple more questions here. Given that we know the virus is spread primarily by asymptomatic carriers, why is the university only testing those who are showing symptoms?
So I think we're actually not only testing those who are showing symptoms, we're testing a variety of individuals that have had exposure. It varies. The primary target, obviously, are those who are showing symptoms, because they're the ones who are probably shedding a lot more virus generally. So we're targeting those, but it is my understanding that we're also testing those who do not have symptoms that have been exposed as well. So even though there's been change in the guidelines from the CDC making optional, we continue to test those negatives as they're part of that contact tracing process.
Dr. Ramirez, do you have a feel for how busy Mary Greeley is? Are they getting a lot of patients, or is it, since we mainly have healthy college students, are those testing positive not getting sick enough to be hospitalized?
So I don't have data directly from Mary Greeley, and I think there's two things to evaluate there. You know, how many individuals show up to the ER to testing, and probably that number goes up. What their status is and whether they truly needed to go to ICU testing or emergency care, that's a whole nother story. What I can tell you is, if you go to the Test Iowa site and you look at the data from the state of Iowa, the actual numbers of people who are hospitalized, and then they do it not by city or county, to do it by region. If you look at the people that are reported to be hospitalized due to COVID for our region, which includes, I don't know, 20 different counties or more, including Des Moines and that, those numbers are very low, both for hospitalizations due to COVID and hospital ICU patients due to COVID. So if you really look at those numbers, even from the whole level, if those whole numbers were all in names, those numbers are pretty low.
Great, thank you. I'm going to send this question to Kristen Obink. Let's see, if as a faculty member, if a student tells us they have tested positive, but we have not been informed about this from the Dean of Students office because perhaps they tested off campus and didn't report, should we contact the Dean of Students office to alert them? Kristen, how should we handle that situation?
Sure. Thanks, President Winterstein. We've been alerted that this has it's been happening on campus. So if a student self-reports to you, we do first and foremost want you to encourage them to self-report through the questionnaire, the self-reporting questionnaire that I mentioned earlier. So that's the main message. You're also welcome to email the Cyclone Health email to let us know about that, and we follow up on those. So.
Great. And Kristen, there's a question, could the university create a dashboard and that they would update daily or at least more frequently than once a week with testing, positive cases, numbers isolating, and quarantine? Could you talk a little bit about our dashboard?
Sure, happy to do that. So we do have a dashboard that will be released later today that we're going to be updating weekly. That does contain that information as stated there, along with some other numbers as well.
Kristen, does the dashboard include anything about testing that doesn't occur at Teeland Student Health Center?
It does. So we have some data on the dashboard that will be included about the self-reports that we receive from external testing sites as well.
Wonderful. And Kristen, if there's an individual who'd like to volunteer as a contact tracer to work with our students, how would they go about doing that?
Sure, you would be welcome to contact us at Cyclone Health at iestate.edu, and we can get you some more information about that.
Great. Let's see, I'm just looking down at our questions here. And Aaron Baldwin, would you want to address the issue of the New York Times article that was just published? What I liked about the New York Times article when I read it was they pointed out that if you're not testing, you won't be on the list. But Aaron, what would you have to say about the New York Times article?
So we saw the New York Times article, as many of you did, and we are actively working with them to understand where they got their data, because it's not matching up with any of the data that we have at Iowa State, nor what has been published from IDPH. So I think I would just ask everyone to take a little pause and let us do some follow-up there, because we have some questions and concerns about the data that was presented.
Great, thank you, Aaron. Another question is there a percent positive rate or another threshold number that will be used by Iowa State to decide to move classes to online and move as many employees to remote working as possible? We certainly have a set of analysis that we are looking at and doing a review of on almost daily basis so that we can judge when we might want to take additional actions relative to COVID cases on campus. And we are going to do a better job, I think, of getting out some more information about how we look at all these different factors. A big one certainly is, again, what Dr. Alex Ramirez has been stating this morning. We don't see, we're not seeing at this time the transmission of COVID occurring in the classroom or the offices on campus because our employees are doing such a good job of following our Cyclones Cares campaign. We just have a few minutes left here. Let me see. There's a lot of conversation about do we have classrooms set up appropriately? We had made a decision that has been talked about a lot since we opened up for the fall semester, and prior to that, that we would go with a 50% occupancy for those classrooms with that 8% distance between the faculty member and the students. We're going to have more conversations here this week about how we have classrooms set up, and we may do some changes there or work with faculty to make some changes. Just earlier today, an individual was sharing with me a classroom that they had been in. There was a lot of room for social distancing, physically distancing in the class, but nonetheless, everyone had gotten kind of clustered up front, which hasn't been my experiences with classes. But we're going to work on this some more and have probably more guidance for faculty yet this week. Let's see if I can go down here. Right, again, another question about the Test Iowa location. Kristen Obing, can you again state, will the Test Iowa results be reported on our dashboard?
So anyone who tests at Test Iowa, that's considered an external testing site to us. Those will not be directly reported to us. They'll be reported directly to the Iowa Department of Public Health, but that's why we're requesting the self-reporting questionnaire. And so for individuals who test positive and fill out the self-reporting questionnaire, those will be reported on our dashboard.
Let's see. If a staff member requests to work remotely in light of students returning or students being on campus, what's the process for approval and support Christy, are you on the panel? I can't see everybody right now. But I think it really is a conversation with the supervisor, and that's how you would proceed, is to have that conversation. It's lots of guidance to supervisors about employees requesting alternative work arrangements. That brings us to the end of our time. Again, if you didn't get your question answered, send it in to the covid19@iastate.edu, and we'll get back to you in a very quick fashion. Thanks for joining us this morning. Thanks to our great panel of presenters. Really appreciate everybody's hard work as we continue to achieve a successful fall semester in 2020. Good to see all of you. Thank you very much.